I'd like to introduce our next speaker. Edelina Bustamante is a registered dietitian at the Perlmutter Cancer Center, and she's going to speak about prevention of recurrence, understanding the role of exercise and nutrition.
So prevention of recurrence, understanding the role of exercise and nutrition. Today we're going to talk about exercise nutrition guidelines that's aimed to reduce your risk of recurrence and mortality in breast cancer survivors. We're going to talk about the registered dietitian's role, because not all of you may know what our role is in the healthcare team. We're going to talk about some benefits to your health and some positive effects of nutrition counseling by a registered dietitian. And then I'm also going to just give an overview of some Perlmutter Cancer Center programs available in terms of nutrition and exercise. So we're going to start with, have you met with a registered dietitian since diagnosis? Yes or no? Will it show me the answer? Okay. Right now. Okay. All right, I'm going to give you a few more minutes to decide. Well, a few more seconds. This one's an easy question. Yes, A, B, no. If you've never met with a dietitian or if you've met with a dietitian. All right, everybody answered? Oh, 73% of you said no. Well, this is a wonderful opportunity for me to talk about my service, or my colleagues and I, in Perlmutter Cancer Center and wherever your medical institution is. All right, so the next thing we're going to talk about is a chart depicting the potential impact of diet and exercise on breast cancer recurrence. I really like this chart, that's why I put it in. It's simple, easy to read. Basically, it's talking about the more you exercise, the healthful your diet is, can potentially decrease your risk for recurrence. It could be related to decreasing your fat mass, increasing your skeletal muscle, which could have anti-inflammatory effects. It could inhibit the action of proteins that promote cell growth and reduce some reproductive hormones. Or it could be related to the healthful diet, may be richer in phytonutrients that have anti-cancer effects, anti-inflammatory effects, and higher fiber. So we're going to talk about some tips on how you can have a healthful diet as well. All right, so this is from the American Institute for Cancer Research. They estimate that 1/3 of United States breast cancers could be prevented by being active, not drinking alcohol, and staying a healthy weight. So how do we do that? Next question. Before I talk about the how, I want to test your knowledge. What is the recommended physical activity in minutes per week? Well, the answer is there. So if you can read, you can see the answer. It's 150 minutes per week, or 75 minutes per week of vigorous intensity exercise. So by show of hands, how many of us have actually met that minimum 150 minutes per week? All right, I would like to see all hands up. So this gives me an overview that we have some work to do. All right, physical activity recommendations. And in the essence of physical activity, why don't we just stand up while we talk about physical activity? And the reason being is there's new research that says that standing up every 30 minutes or so can help you decrease your risk for developing diseases like diabetes, heart disease, manage your obesity, and prevent potentially premature death. So remember, every 30 minutes, all you gotta do is stand up. If you wanna stretch, if you, whatever, you wanna march in place, up to you. All I'm asking is stand up. All right, after we talk about the benefits of physical activity, then you guys can sit down. But for now, I'll keep you standing. So physical activity recommendations, aerobic exercise. We need you to exercise 150 minutes per week or 75 minutes per week of vigorous intensity exercise. I know you guys are wondering, what is moderate intensity? What is vigorous intensity? Moderate intensity could be walking briskly, biking on level ground, doubles tennis, water aerobics, ballroom dancing. Vigorous intensity, lap swimming, hiking uphill, jogging, running, singles tennis, jumping rope. And it's also important to include about 2 days a week of resistance training. But please be cautious. Increase the intensity of resistance training, whether it's light weights or resistance bands. Increase the intensity progressively. All right, so keep standing. After this slide, then you can sit. All right, so the benefits of physical activity is that it can improve quality of life. The benefit could increase physical functioning. It can reduce, if for some of you folks that's still undergoing treatment or just have very recently finished treatment, it can reduce your cancer-related fatigue. It could reduce obesity-related comorbidities, beneficial effects on adipose tissue and your skeletal muscle, and it's a contributing factor in decreasing your risk for breast cancer and mortality. Or I like to tell my patients, this is a free drug. It's not even a drug. It's, no insurance needed. Just be active. 30 minutes a day, or every 30 minutes walk. Instead of sending that email, why don't you just walk to your colleague and actually talk to them, deliver your message in person. Or grab a drink of water, So there are lots of ways to be physically active without having to go to the gym. All right, guys, you can sit. Other benefits of physical activity includes decreasing your risk for cardiovascular risk factors. For us women of color, it's also important to manage our blood pressure, our cholesterol, our hemoglobin A1C levels, and physical activity can help you do that. It helps increase muscle glucose uptake, and being physically active can help with weight loss maintenance. It helps to improve your muscle strength, improve your physical mobility, as well as decreasing sleep apnea, decreasing health care costs. All right, so this is a nice chart or infographic from the American Institute for Cancer Research, and we're going to work our way from the top left to right and work our way to the bottom somehow. So we'll start with maintaining a healthy weight for your height without becoming underweight. Approximately 5% of initial body weight loss can delay the progression from prediabetes, for instance, to diabetes. So besides, prevention of recurrence, you can prevent all these other comorbid related diseases as well. To move more, we know how many minutes per week at least? 150 minutes per week of moderate intensity exercise. And eat well, enjoy a plant-based diet. We're going to delve into that very shortly. So a little word on the reducing your red meat, avoiding processed meat. Processed meat, basically your hot dogs, your bacon, your sausages. So please avoid them as best as possible. Reducing your red meat besides beef, lamb, pork. The American Institute for Cancer Research does allow for less than 18 ounces per week of red meat. So just reduce the amount is the recommendation for red meat. Cut down on alcohol. We'll talk about that a little bit more in detail. Eat less salt. How much is less salt? That's about a teaspoon or less per day, depending on the health organization that you look into. The bottom line is no more than 2,300 milligrams of sodium per day, or less than 1 teaspoon per day, or less. So after cancer treatment, or after treatment, survivors should follow the cancer prevention guidelines, which is basically what we're talking about. For cancer prevention, we don't recommend to use supplements. We encourage you to eat your food first, unless you have some sort of nutrient deficiency. And always remember, don't smoke or chew tobacco. This is from the AICR.org, so please feel free to visit them at your leisure. So what does a healthy diet look like? All right, so the question is, this is also an easy one for you, how much dietary fiber per day do women and men need according to the Institute of Medicine? Thank you. I'm so glad you guys can read as well. All right. So women need about 25 grams of fiber per day, and men need 38 grams of fiber per day. I put that letter A as a trick because the average American actually eats about 15 grams of dietary fiber per day. Bottom line is we're not eating enough dietary fiber. So how can we do that? This is one way. This is the plate model. I show my patients this all the time. They ask me how to eat healthy. You know, what's an ideal meal? What's an ideal plate? This is the ideal plate. Essentially, 2/3 or more of your plate is plant-based foods, so veggies or whole grains, and 1/3 or less is your animal protein. Or another way to look at this plate is that half of your plate is veggies, and then your sides become your carbohydrate and your side of protein. And there's also a big push for plant-based protein. Plant-based protein like nuts, seeds, beans, lentils, quinoa. So these are just as good of sources of protein. And I often get asked, well, what's the serving size of veggie? For plant-based portions, for chopped vegetables, 1 serving is 1 cup, or a visual guide would be a baseball or a rounded handful for an average adult. And then for raw leafy greens like lettuce, spinach, for those of us who like to eat salads, raw vegetable salads, it's 2 cups is 1 serving. So 2 baseballs, or if you make a fist, 2 fists for an average sized adult. Another important portion size to keep in mind is fresh fruit, a small apple or a 6-inch banana, or a half a cup, or equivalent to about a half a baseball or a rounded handful for an average adult is 1 serving of fruit. Okay. So just to delve into the breast cancer and alcohol discussion, so there's convincing effect on the risk of breast cancer when you drink alcohol. It can increase your risk for breast cancer. Why? The question is why. When we drink alcohol, it gets converted to acetaldehyde. Potentially, the more we drink, the more toxic acetaldehyde builds up in our body, and it causes it leads to more cancer-causing damage to the cells. Even a small amount could cause some buildup of this toxic acetaldehyde that could lead to cell damage. Therefore, the American Institute for Cancer Research, the World Cancer Research Fund, recommends that even 1 drink can increase your risk for alcohol. So for those of us in a social gathering, what can you do? Instead of an alcohol, how about grab a glass of water? but spice it up with some sliced up cucumbers and some mint leaves. Hopefully you rinse the mint leaves before you stuff it in your water. You could also get a glass of water, slice up some lemons, slice up some oranges, and that's a fancy mocktail infused water on your hand. Nobody has to know that it's alcohol-free. You can also look up some recipes for infused waters, literally taking a water or water bottle and cutting up some fruits, literally throwing those cut up fruits into your water. It's also a great way to get in some fruits into your diet. All right, so other ways for you to eat more plant-based foods. Start with your morning meal. Throw in a handful of frozen berries, any kind of berries you like, to your cereal. You can start your meal also with a soup or salad, hopefully a vegetable-based soup or a salad. You can leave visual displays of fruit bowls, for instance, wherever you frequent. So if you spend a lot of time at your desk, leave a fruit bowl at your desk. The morning meal also, you can make an omelet, but stuff it with veggies, whether it's mushroom, bell pepper, spinach. You can try meatless meals. You can try, instead of regular burger, portobello burger. Or there are all these different kinds of non-animal burgers now. You can also snack on some baby carrots or bell pepper strips and some hummus. And there are lots of different ways to cook your plant-based, your veggies. For instance, you can roast, bake, grill, broil, or steam your vegetables. So what else? At Perlmutter Cancer Center, for our patients, we have a Get Cooking program in collaboration with the National Gourmet Institute. This is led by our survivorship dietitian, Amanda Bontempo. She has a free hands-on cooking class and healthy eating lecture for our cancer patients. There's also yoga on Tuesdays and Saturdays via the Integrative Health Service. And lectures like these, it keeps you informed, it keeps you abreast of the current research on how you can remain proactive in your health. So transitioning over to the first question, for those 73% of you who've never worked with a registered dietitian, registered dietitian nutritionists are your liaison between the medical team and you. We help translate the nutrition goals or the science of food and nutrition into applicable ways to help you meet your health outcomes, your treatment outcomes. So now that I'm presenting the role of registered dietitians, I also wanted to point, before I move on, that a medical nutrition therapy provided by a registered dietitian can help decrease your A1C, your hemoglobin A1C, by 1 to 2% points. So if you're pre-diabetes or if you have diabetes, this is something I highly recommend to reach out to a registered dietitian. So how can you find a registered dietitian nutritionist near you? This is our professional organization, the Academy of Nutrition and Dietetics, eatright.org. The Oncology Nutrition Dietetic Practice Group is also a good resource. In both their websites will have an area where you can look for a registered dietitian near you based on your zip code. Medical institutions like NYU will have a directory of dietitians in the health system. And these are also some survivorship web resources that you may find helpful: Cancer Care or cancer.net, Cancer Supportive Care, and the Cancer Survivors Project. All right, so lastly, thank you very much for participating in my lecture about nutrition and physical activity.